Good afternoon, ladies and gentlemen. Our webinar is beginning. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council, and we certainly want to thank all of you for joining us today for this webinar. This is an educational webinar, and it's hosted in coordination with Nurses Lounge. And Nurses Lounge is an associate member of the Dallas-Fort Worth Hospital Council. Today's topic, save money and reduce reliance on staffing agencies. This should be a great panel discussion as we learn about a new program that potentially can help save healthcare facilities thousands of dollars related to temporary agency fees, overtime pay, sign-on bonuses. This is a new platform and potentially could replace facilities' reliance on temporary staffing agencies and hourly markup fees. Our speakers today are Tim Alms, President and co-founder of Nurses Lounge, and Garret Alms, who is also a co-founder of Nurses Lounge. Nurses Lounge has been around for more than 20 years, and it's safe and private space for nurses. Before we begin, one administrative, if you have questions, please put them either in the chat or question box. We'll monitor those, and then at the end of the presentation, we'll try to get those answered. And so without further ado, it's my privilege to introduce to you Tim Alms.
Hello. First, I'd like to say thank you for everybody's interest in what we're putting together. And then what we'll do is just go over a little background on us, where we've kind of came from and what we're doing. Then we'll talk about our platform as a service and how we think it could really give you a lot more nurses to fill your staff on a local basis, as well as do it at a flat subscription price. So we think we can save you hospitals, potentially thousands, if not, some cases, millions of dollars. So, to get started, like I said, the first thing we'll talk about is who is Nurses Lounge. Then we'll go over our proposal that we have today and our pricing, talk about a quick history and how we got to where we are, and then the staffing landscape, and then followed up by just exactly kind of the top points on how our platform works. So to get started, Nurses Lounge was created simply to aggregate and connect the nursing profession, nurses, schools, associations, and healthcare facilities onto a single platform. If you think about it, nurses and all the stakeholders are very interrelated. Schools need this, nurses or, students, nurses, associations, all of them are putting out information. And we started with a magazine, and all the information came from one of these three stakeholders. But what it also does is it'll maximize, we set it up so that it can maximize the distribution of information to a very targeted group and audience of nursing professionals. So any information can be delivered to a nurse's dashboard, targeted based on their degree, their location, their specialty. So when you're participating as an employer, you'll have a lounge page, which we call it, which is profile page, where you can distribute news information to very targeted audiences. As well, we provide nurses with a suite of features designed to assist them with the advancement of their career. So as a marketplace for nurses' careers, as an example, presently we have a searchable degree directory with just under 1,000 degrees listed. What a nurse can do is there's 27 categories. They can do a search, pull up a degree with a school they're interested in, and with a single click can request information from a representative that represents that degree plan at that. Instead of having to search around, who do you email to, where can I find the degree, one place, within 30 minutes, a nurse can send off request information from 4 or 5 schools. So specifically for employers, what we have is a suite of technologies and services needed to one thing, to quickly launch a complete branding, hiring, and direct sourcing strategy. So all of that comes with for the employer. It'll also create a local on-demand float pool, enabling coverage of all your PRN and per diem needs. And we'll add facilities, all your permanent jobs on our platform. We have which we call a facility job map. So specifically in Dallas, we'll take all of your jobs, a feed. It'll put a hospital, a pin on the platform or in the Dallas area. You can click the pin. It'll tell you who the facility is, how many jobs they have, and you click it again, it'll open up a list of all the jobs available at that hospital. Nurse can pick one, choose, and then they can apply, move them over to the nurses applicant tracking system, and they can apply on your own website. So, a lot of ability there, just in what you're getting on our platform. So our proposal is, kind of a nutshell, is replace the healthcare facilities' reliance on staffing agencies, and specifically their reliance on their hourly markup fees. And we're doing that with an on-demand staffing platform. It also includes a localized float pool to fill your staff from. And our goal is to approximately get about 10% of the local nurses into our float pool. And through our platform, we've got different ways to do that. And it's all available for a simply monthly subscription fees. There are no market fees. You know exactly what you're paying each month for that. Additionally, we will be offering, what it provides is nurses with a very flexible schedule. And the one thing that nurses all desire from survey after survey is, more flexibility in their ability to schedule and work. So just to kind of get it right out there from the beginning, we have a highly economical subscription-based service for the on-demand staffing platform and supported by the local float pool. Starting at $2,000 for rural or hospitals with 100 beds or less, $5,000 a month for 100 to 250 beds, $7,500 for hospitals with 250 to 500 beds, and then $10,000 a month with hospitals over 500 beds. And I think in Texas, which has more hospitals than any other state, there's only 30 hospitals with over 500 beds. So if you're an average size hospital with 250 beds, your total cost for the platform, for the technology, and unlimited access to the float pool would be $60,000. And again, what you get is unlimited access to the float pool. We give you the facility job map so you can put all of your permanent jobs, basically what you have on your website, onto our platform, and then access to the career marketplace where you can do numerous things to build your brand and to recruit very targeted nurses, get your information out, and things of that nature. So, so just our quick history. We started, I was the founder of jobs.com back in the mid-90s. We were one of the top 5 job boards. We ended up selling it to monster.com. After that, I was approached by Nurses Lounge out of Atlanta. They had a job board they were trying to get off the ground. I ended up just taking it over, brought it back to Dallas, Fort Worth, and we launched our magazine, and we mailed it directly to 35,000 RNs. And it was, and everything about it was, we wrote about local nurses, wrote about local hospitals, local associations, local nursing schools. So all of our content and information came about that, and it was well read. We were very proud of it. And we actually launched it when we launched in 2002 in the Dallas-Fort Worth Hospital Council's office in their boardroom. So we did a presentation and had the hospitals come out to see that. But what was interesting, John Gavris at the time, who was the president, gave me a business plan that they supported in 1999, and the business plan said, hey, let's all the hospitals pull all their nurses onto one platform, and instead of having agency and markup fees, we'll just charge a fee of, say $7 total. That would cover all the expenses. And John, I think, was really behind it. But at that point, with where the internet was, nobody was even sure, if anybody would pay $15 a month for an internet connection. They were a little afraid also that, hey, maybe all the other hospitals would come in and, grab our nurses. So it never got off the ground. And then what was funny, about a year later, I was talking with the president of the Long Island Hospital Council, and he gave me the same business plan. He tried to get it off the ground. So, but I thought it was a good idea, and I kind of kept it in our back pocket. And I think eventually now it's the time to roll it out with the right technology. In 2020 or 2010, we launched our platform. What it is, it's, we call it now a career marketplace for nurses. It was a professional network, is what kind of what we called it when we first launched it. And what it is, it's all the interrelated stakeholders. And if you look at the nursing profession, if you were going to do a network, specifically a vertical, nursing is the perfect perfect network to launch just for the nursing, because you can bring, 800 nursing schools, 5,000 hospitals, 120 or 50 major associations, specialty associations, and then the 3 to 4 million nurses. So you can relatively small, which you can put on one platform and, be and target and distribute news and information. So, so we launched it in 2010 and 2020 when the pandemic hit. We were using third-party software at the time. And we actually took it down and completely rebuilt it again in a proprietary software on a platform. And then and since then, we've added over 180 nursing schools. And fast forward to now, we're in the process of launching our national float pool with an on-demand staffing platform. So we'll give you all the technology. So with that said, if you want to look at today's temp industry, you see that it's really kind of amazing where this thing has gone. Just over the last 10 years, the number of healthcare staffing firms have doubled. So today, there's approximately 500 firms that are using the on-demand mobile app staffing platform. There's quite a number of places that'll build it and they'll white label it, and pretty much every staffing firm out there is going to that single platform. So that's 500 different apps that'll be out there for a nurse. And I think we all realize that can't last. No nurse is going to download more than 1 or 2 or 3 apps, especially if they don't know who the staffing platform is, who their clients are, who they're going to work for. So there's a lot of unknown information when you download the app and with a staffing firm. Additionally, 15 agencies have raised over $100 million to date, and the majority of their spend is going to recruit nurses to download their app and to come on their platform. And so you're talking millions of dollars a month in some cases that these agencies are spending a month. And so that's a lot of competition. If you think about who you're competing with for nurses, it's just not the other facilities local. They're not spending anywhere near of what mass amounts of these staffing firms are spending. So, and if you think about it, when you look at the platform, the agencies see this as a staffing agency. We're looking at it more from like an Uber, Lyft, or even the vacation rental programs such as Airbnb and VRBO. And so right now, you can think of 500 apps, but where it's going to go to is going to have to consolidate and again, we're not a staffing firm. We're just creating the technology and the platform at a subscription-based model. But if you have a rideshare app, you've got two apps. It's Uber and Lyft. And if you're doing rental vacations, then you've got two apps. It's probably Airbnb or VRBO. There might be some small ones out there, but it always comes down in the software business down to one or two or three programs that are used. And you can go look back at the browser wars when the internet first came off. From from just about any segment. There's one or two winners that have the share of the marketplace, and so we see that's where it's going. And when we hope to be there, because we're coming in with a model that is totally different and can save millions dollars compared to what is going on today. So, and if you look at the state of the nursing profession, where there's huge demand, and Texas Hospital Association looked at it, says 64% of Texas hospitals turn away patients for lack of nurses. That means they can't even pull all the income that they can create because they can't fill all the beds. They don't have, they can't optimize the staff needed to do so. So, there's some big problems out there already. 35% of nurses say they are extremely are likely to leave the profession in 2024. Now, I don't think anywhere near that's going to level will happen, but there is a discontent out there that's got to be addressed on some level. And they feel, the number one reason they feel burned out, nurse does, and they feel overworked and undercompensated is the reason for their burnout as well. And studies show that nurses overwhelming, what they want is, what you addressed earlier, is a flexible work schedule. They want more flexibility in it. And, nurses that, right now they're working a day shift, and their hospitals are asking them, hey, can you work one or two midnight shifts each week on top of that? And so, it's hard to do. It's hard to say no to. So it is and kind of got, if you look at it, you've got the nurse, the facility, you're kind of a rock and a hard place. You've got the nurses over here kind of rebelling and, kind of wanting out and not doing where it is because there's not enough staff. And then you're competing with these staffing agencies who are, if you go to their website, the first thing you see is work when you want to work, where you want to work, flexible schedules, and they pay well. And so it's just hard to compete, with these things to an act. And I think, what you'll see today is that we can address both of those and give you, the access you need to the nurses and also the flexibility that they're looking for, and do it at a much cheaper rate than, you probably imagine that, you possibly could. So,
yeah. Thank you.
Anyway, and I'll turn it over to Garrett, and he'll kind of get down into the nuts and bolts of what our platform does. So thank you very much.
So the three suites in the suite of technologies, we're offering kind of three things here. The on-demand staffing platform, which we call the float pool, the facility job map, which is going to contain all of your permanent jobs, and then access to the career marketplace, which is to think of as the branding and prospecting platform. But just to go over the on-demand staffing platform, I want to give us a bird's eye view of kind of the workflow of how that lays out. So at the onset, nurses will download the app. They'll upload their credentials, requirements, whatever the app requires of them, they'll upload those. 2, the employers will then access a workforce portal and add shifts through the workforce portal. The Nurses Lounge technology then takes over, determines the best qualified nurse for that shift. Once a nurse then applies to a shift, the technology tracks all the hours worked, calculates the pay. Now, full disclosure and transparency right up front, Nurses Lounge does not hire nurses, and we are not responsible for paying the nurses. We do not W-2 the nurses at Nurses Lounge. They do not take drug tests or background checks through the Nurses Lounge. They will be put in through your hiring process, and the facility will be responsible for paying the nurse. But to dive in with the nurse on how they would use the app, we are already live in the Google and Apple app stores, a nurse could simply go there, download the app, upload the credentials to be pre-qualified to be input into their local float pool. Once they're pre-qualified, they will start receiving notifications of local shifts in their area that they qualify for. They can use the app to manage their upcoming schedules. They can view directions to the facility. They can use the app to check in and check out of their shift that they're working. That way the app tallies all their hours worked and the pay. And then on the other side, the facility, your hiring team, will access a workforce portal. They will use the workforce portal to add shifts. They can add shifts, the qualifications criteria for that shift, what type of licensed individual they need, the time of the shift, the pay of the shift, and any specialty requirements or credential requirements for that shift. But your hiring team will access the workforce portal, and then the nurses will access the app, and the technology is going to pair the two together. Now, to be upfront and very clear, facilities cannot use the workforce portal to search for or see nurses in the float pool until they apply to the shift. A nurse must first be made aware and notified of a shift, apply to that shift, then and only then can your hiring team view that nurse's credentials and even chat with that individual to work out details in case they need to go through the onboarding orientation process. But let's dive in. Technology is going to work. So what we've created here is a little infographic to illustrate how the technology works. Now I want to draw your attention over to the left column here of the grayscale nurses represented as the DFW float pool of the Nurses Lounge float pool. So what we're going to do, we have an internal Nurses Lounge team that's going to pre-qualify nurses. Nurses are downloading the app, they're uploading credentials, where our internal team will determine that this is a real individual that has a license, that lives in the area, that has a degree, uploaded their resume, has completed their profile of the Nurses Lounge to be pre-qualified. Step 2, your team will enter the workforce portal to add shifts. Those shifts will then go out to the pre-qualified nurses. They can then apply to a shift. Once that nurse works a shift, your hiring team gets to rate that nurse. So the nurse works the shift and you can rate that nurse 1 to 5 stars. I just want to take a moment to talk about the rating real quick. 1 to 5 stars not mean bad or good, right? 5 stars meaning great nurse, 1 star meaning bad nurse. You're rating the nurse to determine who's your preferred workforce. So if you rate a nurse 5 stars, this is somebody with experience that you enjoy working with, that you've developed rapport with. They might be 5 stars. A 1-star individual might be someone that's new, you've only worked with a couple times, but still is in your preferred category. So your goal as a hiring facility would be to get as many nurses in your facility float pool. So Nurses Lounge is going to pre-qualify nurses, onboard them into the grayscale, input them into the float pool. You add the shift, the technology will find a qualified nurse for that shift. You determine if you want to hire that nurse or not. After that nurse works a shift, you rate that nurse, and now for all preceding shifts, you have now added a nurse to your float pool by rating them. So let's just dive in to how that would work real quick. So I have another infographic to kind of show you how that shift moves along and finds the correct nurse for that shift. So we have our 3 colors here. We have the dark blue. That's going to represent your most preferred nurses. The secondary blue is going to represent all of your preferred nurses, 1 through 4 stars. And then lastly, is going to represent all qualified nurses for that shift. So your hiring team will use the workforce portal to post a shift, and then it'll try and find the most qualified nurse for that shift based on the nurse's credentials, locations, and your preferences as whether you have not 5-starred that nurse or not. It'll go by 1 at a time depending on the upcoming shift, and it'll start to send out in batch the closer that shift comes. But then if it doesn't find any of your most preferred nurses that meet that shift, it'll send out to your second batch of nurses that are in your qualified list. And then lastly, if it still the technology hasn't found a qualified nurse in your preferred list, they will then be added to the last layer of the list. Your shift will go out to the grayscale nurses and the Nurses Lounge float pool, in which you can onboard and then rate. And then once you rate that nurse, they are put into your preferred list here. So the idea is how can you as a facility grow your pool of internal float nurses from the nurses lounge float pool? Because again, it's a subscription fee. The more nurses that you're hiring out of the float pool, it doesn't matter. You're still going to pay the exact same subscription fee. And maybe a nurse decides, hey, you know what? I really like working at this facility. I want to be a full-time nurse. Great. You can hire that nurse full-time. There's no extra cost to onboard that nurse as a full-time nurse to go ahead and use for a permanent position there. But that's just to kind of illustrate how that technology works. You post a shift, it moves out through your preferred categories. It tries to find a match. The app, the nurse will then use the app to apply to that shift, and your team can go through there and monitor and track hours worked and hours paid. All right. So that's to wrap up the float pool. So second technology, we're also going to give you the map for all of your permanent jobs. So you have we have a facility job map. So what we're going to do is we're going to take an XML feed or a JSON feed. We'll work with your applicant tracking system. We'll import all of the jobs to the map. And that our goal is to map out the nursing profession. We currently have about 20,000 nursing jobs on the map through hundreds of facilities. But then we can take that feed, and that way we can get all of your permanent hires. We have tens of thousands of nurses doing job search on our job map each month with a growing audience at that. And then lastly, we're going to give you access to our career marketplace for nurses. Again, this is how we are. You can think of the marketplace as a planet, and then the nurses, the schools, and the associations as the satellites orbiting that planet, right? We want to keep the nurses and the profession in our orbit. And that way, when we onboard these nurses through the marketplace, we can then funnel them into the float pool, the DFW float pool, for example, giving you access to a broader range of nurses that you can add to your preferred workforce there. But we are working with, to show you where we are working with over 180 nursing schools. They have uploaded over 900 nursing degrees so far in our career marketplace. 30 Texas nursing schools have onboarded so far. And you can see this little example from the University of South Carolina here. This is an invite that the faculty, the dean sends out to all of their students, alumni, asking to follow the school and the nurses lounge. We have TADDP&P in our career marketplace. This is the Texas Deans Organization. So all the Texas Association of Deans and Directors of Professional Nursing Programs. They use the Nurses Lounge Marketplace to share all of their meeting minutes with all the Texas Nursing School Deans and Directors within that organization. And then lastly here, we have the NADANA LTC. That's the National Association of Directors of Nursing Administrations and Long-Term Care. Just an example, how they put the Nurses Lounge social icon at the bottom of their website. Again, we're working with the specialty associations and nurse organizations to onboard them into our marketplace with the goal, put them into our orbit with the ultimate goal of getting more nurses funneled into the float pool, in which your facilities can reduce your reliance off the staffing firms, start building and curating your own pool of trusted nurses. That way you can start diving into that, reduce that reliance, and save hopefully hundreds of thousands, if not millions of dollars, while still not worrying about the patient outcomes, working with nurses that you trust, knowing that they're going to be onboarded in orientation through that process, and you're going to pay them as the W-2 nurse. But Nurses Lounge, again, is the suite of technologies that we're using to help you reduce that reliance off the staffing agencies. And I think Tim was going to maybe close us out with a few words here, and then we can open it up with some question and answers.
All right. Thank you, Garrett. Yeah, I think you can see it's a pretty simple idea. The technology is here, the ability to do it, the pricing is right. Staffing agencies started really after World War II, and I think they've had their runs, specifically for the nursing profession and healthcare facilities. It's kind of a new age. So we're really excited about it and think we can deliver a great product and service and save, everybody money and make nurses happy and facilities happy as well. So you can see, as from a career marketplace, we're a one-of-a-kind service. There's nobody out there that even close to what we do. And, as a rule, of a network like Nurses Lounge, is the greater participation you have, the greater value for all. So the more nurses that join, the more valuable it becomes, the more schools, the more associations, the more employers, the more you get, the more you get. So we think we're on track, and especially with this launch to really, unite the nursing profession into one platform. So as we kick this off, it's kind of just some of the things that we'll be doing. We'll be approaching each school. We're going to do a membership drive with them. They'll be inviting all of their nurses, sending out, an email, kind of like you saw South Carolina had done. And when they'll do it. It's all BSN schools that we'll be working with. So this is a great product and service for graduate nurses in their graduate degree programs. And I think even at one time we had more MSN nurses than we had BSN nurses on our platform. So, we think, it's going to be more of an incentive if they can, have the flexibility to work with all the local hospitals. Additionally, we're kind of going to bring back our magazine, and we've got a mailing list of 60,000 DFW nurses. And we will publish a version of our Nurses Lounge magazine, which, we stopped in roughly 2011. It'll introduce the service. It'll talk about it. We're going to list all of the hospitals that are participating. We'll also talk about, you can we'll do a little profile on you for each school. We can put together, if you have a time when you would like to have an onboarding session, so you can bring nurses out, so you can put them in your float pool and have them, start working, and where you can pull them in for your staffs. The other thing is that, you can bring in your nurses and use our technology. Again, nobody can, no hospital can sit down and say, I'd like to see all the nurses that work for so-and-so or all the MSN nurses. All they can do is you can put it in the shift and put it out there, and qualified nurses will apply back. And that's, when you get to see who's in the float pool. So we'll be doing a lot of other newsletters out to the members of the float pool. And so we'll keep them interested and, work with you to really brand your hospital with these hospital nurses. So anyway, to get started, if you go to nurseslounge.com, up at the top right-hand corner, we have a schedule a demo. So if you can schedule a demo, we can give you a 30-minute demo, show you the network, show you what the platform is, kind of the nuts and bolts of it, and get you started. And it's going to be, just that simple, very little work on your side. Technically you could say we're a direct sourcing platform, because, you are doing the hiring directly. Unlike, as I said, we're not an agency, so, we don't hire nurses and then send them out to your facility and, charge a markup fee. So we're just providing the technology. So anyway, so appreciate it. Look forward to hearing back and getting you guys signed up and launching here in the Dallas-Fort Worth area. I think it's a perfect time to do it. So anyway, appreciate it. And thank you, Dallas-Fort Worth Hospital Council, for allowing us this time.
Yeah, absolutely, Tim. You and Garrett did a good job. No current questions in the Q&A, but a couple of questions that people sent to me that couldn't be on today. They're going to listen to the recording. Can they take their current staff of PRN per diem nurses and add them to the Nurses Lounge float pool?
Yes. Garrett, you want to answer that? Or?
Yeah, to be it's a little expand on that a little bit. The answer is yes. Again, you do not have to worry about a competitor facility or agency coming in and poaching your nurses. All of their information is private. So if you wanted to, say, upgrade your technology for the PRN per diem nurses that are working shifts, you can invite your current internal float pool to download the app. Hey, come work a shift as they become available to you through the app. I will rate you as a 5-star nurse. Now you are on a preferred list. So each preceding shift that I post through the workforce portal, those preferred nurses will then get those shifts. And again, they cannot be poached or seen by anybody else. Your PRN per diem nurses would have to actually apply to another shift and then go on board and orientation through that facility, right, to go through that. So I would say yes, absolutely on board all of your PRN per diem nurses.
The other question was, once you use the nurses lounge float pool, and especially the workforce portal, can you chat with the applicants before you assign a shift?
Yes, good question. So obviously, probably a big concern is, who is this nurse? Who's going to be working this shift? I don't know this person, or do I? So if a nurse applies to a shift, you then will be able to see all of their credentials, resume, and you will even be able to chat with them about any particulars that might be missing. And that could be very key, right? So if you want to chat with them, say, hey, you know what? You look like you're qualified to work this shift, but we need you to come in early so we can get some paperwork done. You can do some onboarding and some orientation because you haven't been here. Or the hiring manager might say, hey, look, this is nurse so-and-so. They've worked with us in the past. I'm going to go ahead and assign them to a shift. They work this shift. Now I make that nurse a 5-star rated nurse. For each preceding shift, that nurse is going to be on the priority list of getting those shifts there. So
What the other question was, when someone signs up and you assign them a shift, and let's say they go do the shift, when in the process are they kind of verified, all their background screening done, just to ensure that they are who they say they are?
Yep. So again, our nurses lounge internal team will have a pre-qualification, right? So you have to upload a picture, you have to put up your resume, your license, your degree, etc. So that way we kind of predetermine, okay, this is most likely a real person that looks like they've got good credentials here. Then the employer, the hiring facility, will add a shift that technology matches up the shift with that person. So if this person has never worked with your facility before, your hiring manager will have to preemptively, proactively chat with that person. There will be a little bit of upfront work there. Figure out, okay, I need you to come in on this date so we can do a background check and a drug test and we get the onboarding done. But once that's done, right, you can now bypass any staffing agencies and use that nurse into your preferred workforce. Does that answer your question there, okay, you think?
Yeah, that really helps. I know you touched on this, and I think Tim covered it and you did, but I got a question. Can we put our permanent nursing jobs into the facility job map?
Yes. So again, we have a suite of technologies that we're offering employers. We have the float pool for your per diem PRN shifts. We have the facility job map for all of your permanent hires. And the way that works is we'll work with your applicant tracking system, whoever you currently have. We'll obtain it's called a JSON or XML feed, import those jobs to our job map so they automatically update with present jobs, current jobs every day, and your team will have full analytics on those jobs as well.
So, Garrett, you bring up a really good point. When you look at the applicant tracking system, when you upload, you've got the software to take care of that. The facility doesn't have to worry about interfacing their applicant tracking into you, correct?
Yep, correct. So if I'm a nurse and I find a job that I'm curious about on Nurses Lounge through the job map and say I want to apply to a job, as soon as I click that apply button, I'm going to be rerouted to the employer's applicant tracking system. I'm going to apply to your website through your applicant tracking system so your team can get all of that data.
Yeah, that really helps. That makes a lot of sense. Those were all the questions that I had. I'm checking the chat box and Q&A. Don't see a lot of questions, but I just want to say thank y'all. You did a great job. You did a good presentation. And Tim, I'll let you and Garrett have the final word before we conclude.
Well, like I said, I think as a facility, you're probably feeling pain now on the nursing shortage. The nursing shortage is going to get worse. Where the on-demand staffing and the agencies are, that's going to have to, that's going to play out. So there's going to get a consolidation, but there's no end in sight. With nurses wanting more flexibility, getting burned out, you can, use this not just for, an open shift, it's for overtime. So if you, instead of paying overtime, you know that you can bring in nurses through the platform. Again, you can hire them full time. We don't care. We're just providing the shift, giving you access to all the nurses, and, you know, do with what you like. But we will save you money. And, you know, if you save you $1 million a year, you know, add that up over 5 years, that's $5 million. You're starting to talk some, you know, really serious money. And, you know, and for a lot of facilities, you know, this is an out of control expense that you just don't have any control, is the staffing fees. And you now have total control of that. And the more you use it and work it, you know, it won't take over everything starting, but, you know, by the end of the first year, we think we'll have close to 10% of the nurses in the float pool and plenty of people interested in, you know, you're taking the shifts and facilities. So.
Right. Well, Tim and Garrett, on behalf of the DFW Hospital Council, we want to thank you. Thank you for coordinating with us on this webinar, and we appreciate the information that you gave us related to Nurses Lounge. For the participants on, you will get a copy of this, and all the people that signed up, even if something conflicted, they'll get a recording of this also, so that they can hear this webinar in its entirety. So with that, we will conclude, but thanks to everyone for your participation.
Thank you very much.
Thanks.
Mr.